Bay, approximately 7 minutes. Over.
John 5, 8-year-old child fallen from the fire engine, unconscious, and ETA is 7 minutes.
It's mid-evening. 8-year-old Antony Barrowcliff arrives at Alder Children's Casualty Department.
3, 2, 3.
Right. What's his name, do we know? Antony. Antony? Hello there.
Antony had been indulging in Liverpool's latest craze. He'd been riding on top of a fire engine on an emergency call when he fell off. He suffered serious injuries.
That's all right, What are we doing with lines, guys? Got one and got some blood. Okay, well, let's get ready to tube him now.
The team's concerned that Antony's fall has damaged his brain. To help fight any brain swelling, he's sedated and put on a ventilator to take over his breathing.
Is there any parents with him?
Antony's father was one of the first to reach him.
Dad's in the bells room.
Was he unconscious immediately, or did he?
He was just lying shaking and screaming, but he wasn't responding to what you were saying or not.
Right. So he was making some noise and some movement.
We're going to be going for the scan as soon as possible, and I want these be done now.
What I understand, he was on the back of a fire engine. He decided to jump off. I believe he jumped off. I don't know if he fell. Some were saying he jumped and some people said he fell, you know.
Before deciding on further treatment, Antony's brain is scanned to assess the extent of his head injuries.
Everything from on that to me looks like it's going that way.
It does look a bit, doesn't it?
And as you're coming down here,
there, like, yeah.
not there. See that's not partial volume. That is a bit of blood. And everything, and that side of his ventricle is completely squashed, and that's all over there. So that's all been shoved over. And again, it's a very thin little subdural. Basically, he's got a little bit of bleeding around the edge of his brain, not actually in the brain itself, but the whole bash of the head has caused the brain to swell as well. And with this little bit of bleeding, it's caused a bit of the shift of the midline structures. In other words, the structures of the centre of the brain have been pushed over, and that again is an indicator of how much the brain has swollen.
Maybe we should have waited for the water.
Antony is now handed over to the intensive care team.
The bleed's small, so he's probably not going to need neurosurgery. But he does need intensive care. He'll have to be ventilated. His brain's quite tight, and we've got to keep his CO2 low. So he's going upstairs to be put on a ventilator, sedated, kept quiet until things start to resolve.
It's very easy to spend time just sitting here by his bedside worrying. It's important that you get some sleep and that you get some food. Things will seem about 20 times as bad if you don't get any sleep and you don't get any food. Any other questions?
Could this get really bad?
It's difficult to say. There's quite a lot of swelling and it's quite early on. We'll plan to rescan him in the morning so we may have a good idea of what's happening.
All you can do is go crazy.
It's 8 in the morning. Antony's grandmother has been with him overnight in intensive care.
Antony Jones, what are you like? Okay there? Yeah, I'm fine. Okay. He's going to be fine. Just know that. Got to look after him. Yeah.
The thing is, we just have to wait and see. Very often, if there is swelling, it can be minimal, if nothing at all.
Yeah.
But he has had a bleed in his head,
yes,
and it's areas where the blood is that can make that bit of brain die.
Yeah.
So it depends on the extent of the bleeding, which is again why they want to scan him again
so
today.
You'll have an even better idea once he's been for the scan.
Yeah, we just need to wait and see, but he's still a very, very poorly boy, and things could go either way still.
I'm going to go and do what I do best. I'm going to pray for a long time.
Have a time, have a cup of tea.
On the other side of the hospital, 5-year-old Nikita Ireland is back at Alder to begin a crucial stage of her treatment for cancer.
She's come in for chemo. chemo, thank you.
When it goes inside you, it makes you better.
It's basically the start of the last lot of treatment.
You don't know what's going to happen today.
No. All we know is it's chemo and that's it.
Yeah, okay, right, we'll put this bag up for 3 hours. That'll be about 10:30, 11:30, 12:30, 1, okay? Where's Wilbur? Should we try him out? We haven't used this one before, have we? And which colour Wilbur are we going to use?
Maybe the red.
The red one? Why the red one? Is it best? Okay.
A
is your
year
neck
ago,
stopping?
doctors discovered Nikita had cancer.
Okay, should we pull your shirt down then?
A tumour was removed from her abdomen, but despite intensive treatment, there are still cancer cells throughout her body. Without further treatment, the cancer will probably prove fatal.
Right, you're going to ride. You're having a ride? You're going to hold this?
Next time, don't try.
Nikita's to be offered a new treatment involving high-dosage chemotherapy to destroy the cancer cells.
Is someone going to be using them?
Orthopaedic surgeon John Dorgan will spend most of today in the operating theatre. He begins by seeing 2 of the patients on his list.
Can I sit on the bed? How was the lump that was got there? How long has it been there? Is it very sore?
8-year-old Kate needs to have a harmless lump removed from her hand.
It's a bit sore, yeah. She's got a fairly large swelling. It's a ganglion on the wrist.
She does gymnastics, so after games it tends to be a bit painful.
Yeah. So while you're asleep, we'll get rid of it for you. You'll be able to go home later.
We're hoping it won't come back.
Okay, see you up there then.
All right,
Thanks.
thanks.
Bye-bye then.
Bye-bye.
Drawing.
Hi. Hi, Doctor. Okay. That's fine. You, yes? So how old is David now, Mum? Can't remember.
Like 6 months.
6 months. And it was the left foot that was the problem. Hello, David. Can I have a look at your feet? That's all right. Really big eyes. Oh, dear me. Oh, sorry about that. Don't you like strange men? Oh, dear. Not very happy. This is a normal foot on the right. And on the left side, he's got a foot that's been born, a club foot. That means the foot is held with the heel pointing downwards towards the ground and turned in. It's very, very sick. Oh, I'll leave you in peace. Okay. All being well, go home tomorrow. Obviously stay tonight. And go home tomorrow. Okay, then.
It's all right.
It's okay. All smiles now. Yeah.
Going to know the secretary now. Sue is absolutely invaluable to me. She's been my secretary since I got my consultant post, and before that she was secretary when I worked at the Royal Liverpool Children's Hospital, Myrtle Street. This lock plays up every time I try it. There we go.
Did John want to speak to you about next month? I think he wanted you to see a patient. Or
I should be here. There's an examiner's meeting at 5:15, which I hope is very brief.
Just Bolton play.
Because Bolton against Spurs, I'm not missing that game. I've got my ticket already for that one. It's a 7:45 kick-off, so I should make it.
In intensive care, Antony's condition has not improved.
We're taking him back down for a CT scan because his heart rate's been dropping quite low. And we're concerned his brain's even more swollen. So we're going to go down to scan now and check on that situation.
To assess the scans, the hospital's neurosurgeon Paul May has been called in.
Around. I mean, I think he's got a little extracorporeal blood.
It's got quite significant cerebral edema, isn't it?
Yeah.
Paul has to decide whether or not to operate on Antony to control the brain swelling.
This is yesterday's film, and you've got the 2 bodies of lateral ventricles there. On this film, you can only just make out the right one, which means his brain has swollen up even further.
The little blood clot that he's got bruise more in the left-hand side of his brain in the speech area may get bigger, but at the moment I would leave that alone because I think operating on it is going to cause him more trouble because of damage to potentially speech or movement in that left-hand side of his brain.
Antony's taken back to his parents in intensive care. Nikita will receive her high-dosage chemotherapy in 2 weeks' time. The treatment is so toxic that it'll destroy her bone marrow and with it her body's ability to produce blood cells.
I'll kill you for getting all over me. Do you want some makeup on?
Nails.
Before the chemotherapy, Nikita will be given drugs to stimulate production of a particular type of blood cell in her bone marrow.
My hands are on the way round. You need them that way. Nikita, can I interrupt a minute? Can I just get at your line and put your medicines in? Is that okay?
Yeah. Don't put all over my leg.
I always get your leg wet, don't I?
What's this?
This is the Mesner going in. I'll put the cyclophosphamide up in a minute.
Yeah, it looks nice, doesn't it?
Yeah.
See how strong it looks when it's on there.
How much do you have to spend in makeup every week then?
A bit strong.
Couple of pounds.
The special cells, called stem cells, will be removed, stored and put back into Nikita after the high-dosage chemotherapy. This will allow her bone marrow to recover and produce blood.
That looks like blood, right?
John Dorgan is ready to start operating.
He's not with you today, are they?
They're just about to start the first case. You got a patient? I'll go get changed then, yeah. So. You do it, yes. That's right, yeah. Wrong combination. Thank you. There's so many combination locks in the hospital, you have to start thinking which ones. I love operating. Operating days are the best days of the week. Once you scrub up and start operating, it's wonderful. Everything else disappears into the background, and I could do it every day of the week if they'd let me, but we have to do clinics as well. We're going to move the child down to the bottom of the table so we can sit around. He was crying a bit this morning when we saw him, but this is the normal foot, which is at the normal position, whereas on this side, it's pointing in. It won't come up at all, it's fixed. I can't bring that up to a neutral position. It should come up to about there, but it's absolutely stuck, pointing downwards. That's because of a very, very tight heel cord. We have to release it. I don't know if I should mention today that Bolton lost. Man United have lost 4 in a row, so it's very good news. You got any gloves, Gary? No, Never passed my theatre nursing course, yeah. A lot of our work is training junior staff. And so we get trainees through here for 6 months, 6-month periods. They're not beginners, they're all done several years of surgery. A lot of the straightforward operations they can do without our help, but we train them. And that's the only way to pass on the knowledge that we've gained to the future surgeon. Are you a football fan, Kevin?
No, it's got to be oval and pick it up, I'm afraid.
Do you play?
I used to play. I fractured my skull a couple of times, so I had to stop.
That explains a lot. Okay, to start, Fiona. So with a tourniquet on, there'll be no bleeding when we cut through the skin. Mr. Nikita has done a lot of club foot surgery before he came to us. He's a very experienced surgeon. In fact, when he goes back home to Malawi, he's going to be the 11th orthopaedic surgeon. There's only 10 for a country of 9 million people. So. And Mr. Sharp's only seen a couple of these before, so we're showing this is a different way of doing it to the way he's already seen. Don't start undermining the edges till you get down to the tendon.
In intensive care, Antony's parents are waiting for the results of his second brain scan.
Paul Baines, one of the ICU consultants. I spoke with your husband before. How's it going?
I'm like confused at the moment, so.
Okay. It's difficult to know how things will go. We just keep them quiet and just see how things go. And in a day or so, when the scans look like the swelling settled down, we'll wake him up and see what he's like. I think the really difficult thing is you just have to sit it out and wait and see how things go.
Any difference between the scan of yesterday and today?
Yeah, it's a wee bit more swollen. But that's what you'd expect, just because we scanned him pretty soon after it had happened. And it always gets a little bit worse, just because these things take a little while to develop. It's no worse than we'd have expected, you know, no worse than would have happened just by progression of what he had already. It's all a lot to take in all at once, I know. And if you do have any other questions, you can ask Tracy, or one of us is always around. Okay. See you later on.
All right, thank you.
You could make a very good recovery, or he could have major problems and be left quite severely disabled. I think he will probably make a good recovery, albeit after some time. But as I say, there's a wide range of extremes that you may see here.
On the oncology ward, Nikita is still receiving her medication. She's been in hospital over 20 times since she was diagnosed with cancer a year ago.
She understands in her own way. We've explained to her everything as much as we can in her terms and a way that she would understand. And like when you explained to her about her hair, didn't you? That she would lose her hair. So her attitude was, fine, if I'm going to lose your hair, so are you, Dad. So he ended up getting his head shaved. We didn't think we'd get this far, but we have.
The worst question is, when am I ever going to be better? Because you just can't answer it.
No, we can't answer that. All we can say is we're getting closer. We know she'll never be clear for the rest of her life. We know that, you know, but all we can hope is that we get her into remission and keep her there. That's all we want now.
In theatre, John Dorgan's team has come to a key moment in the correction of 6-month-old David's club foot.
That's the Achilles tendon. It's going to have to be lengthened because it's very, very tight. So we're going to divide it in a Z shape. You cut it halfway across, then down the middle and out at the other side and let a Z. And the two bits will slide and you can fasten them together then. You've gained so much length on it. And already, you see, we've got some correction. The next thing to do is to release the joints here. Have you got a small Langenbeck, please? That's a lot more correction. But you'll see now, Kevin, feel it.
It's really good.
So that's in a very well-corrected position. The toes are not tight. We've lengthened the muscles there, so we have to now just repair the tendons that we've lengthened. Remember, the end of this tendon came right the way down when we started, because the foot was right round in that position there like that. So that's the length we've got on that. It's a length of about an inch. Join that back together in that position. If it's left untreated, which we don't see in this country, but my colleagues from abroad send me photographs of a totally untreated club foot where they're actually walking on their ankle because they're right over. I think the standard here is as high as anywhere else in the world. That's why a lot of people come here to train from overseas. So at the moment we've got a lot of staff from overseas. We've got a Russian doctor who's just joined us, Malawi, we've got several from India. And one from Bebington. Right, switch the blood on, thanks. Yeah. Tourniquet down, please, yes. Tourniquet time.
40 minutes it is.
40 minutes, right. I think theatre should be a happy place to work. I think the main thing is if the surgeon enjoys his work and he's happy in theatre and he's relaxed and pleasant to the staff, then I think everybody else is happy. David, you all right? Got him?
Yep. Thank you.
Hear of surgeons throwing things around in theatre, I think they're in the wrong job. We're going to carry straight on to the next one. Is that the plan, man?
In the 16 hours since Antony was seriously injured, he's been receiving constant intensive care.
We're just going to clean his eyes, change his jelly pen, which will keep his eyes nice and moist, and we'll clean out his mouth so that he's more comfortable. I'm going to put this on. It's just a clear jelly. It's full of fluid, and you just place it over the eyes. It stops dust getting in. It's been very stable. He coped quite well with having a lot of handling throughout his scan, other than his heart rate dropping now and again, which is just a sign of intracranial pressure. He's been quite stable. Again, because he is paralysed, he's not actually licking his lips, so they get quite dry. And although he is sedated, it's not fair to make him feel uncomfortable.
John Dorgan's team are about to begin Kate's hand operation. He's performed hundreds of similar operations over 23 years as a surgeon.
In the UK, you have to retire from the NHS at 65 and you can carry on privately as long as you want, which I personally think is wrong. I think at 70, your licence to operate should be revoked. You hear the odd story of 80-year-olds still operating. I wouldn't want to be operated on by an 80-year-old. We'll go to the door and one of the carpenters. I'll try and ignore these as long as possible. All right, start, yeah.
You might need a bigger hole, you know.
I think you need a bit more space there.
You're struggling down this little...
This little grey-blue cyst there is the ganglion. It's just a fluid-filled cyst that arises from the joints on the back of the wrist. You got the root of it then? Yes.
Yeah, I mean it's
going right down to the joint then, yeah. The ganglion's been taken out now, and so you're just going to close the wound. Now in children, we always try to put stitches in that are hidden and will dissolve, because one of the problems for a child is having stitches taken out. Bit of local anaesthetic in, have you done that?
Oh gosh, yes, let's put that before we get...
Local anaesthetic just so that she has no pain and she can go home later on this afternoon and...
It's 5 mils.
She'll get hardly any pain anyway, it's only a skin wound.
5 mils will be about the size of the gang.
Oh, you ready?
Yep.
John's next operation has been cancelled because the patient has flu.
What we had scheduled today would have filled the full list, but with the last case being cancelled, that's 2 hours worth of operating time lost today, unfortunately. It's too late to send for anybody else. Oh, that's good then.
Sweet one's Kate. She's had a ganglion removed from the back of her hand. Just a bit local in her hand. Nice to hear.
Hardest part of the operation, gets back into the locker.
So you've got to go to your aunt's.
Nikita will now have the first of a 10-day course of injections to stimulate the production of her blood stem cells.
Close the door and then...
If she isn't too distressed by this injection, the team will let her receive the rest of the course at home.
You've marked the spot, have you? I've got to do it there. Right, OK. But I won't give it on there, but I'll give it around that area. Is that OK? So if I just hold it like that, so that just lifts the skin up a little bit for you. And then this is just under the skin, Nikita. If you can just hold still, darling, that's it. Breathe. A nice deep breath.
Come on.
Oh, a lovely deep breath. Good girl. A wonderful...
That's a good girl.
Gosh, I think I'm going to have to give you a bravery certificate.
Right.
There we are. That's it all done. That was wonderful. Tell me, how was that?
All right.
Was that all right?
Yeah, and it was the correct way.
Well, thank you. So that's the way we've got to tell everybody to do it, isn't it? OK, we'll give you this because I think you were extra special. So I'll write on it, shall I? I'll come and lean on the trolley here and I'll write. You have been very brave today. There we go. OK, well, that was great.
Nikita will now be allowed home for 9 days and will receive her injections from a visiting nurse. Before he goes home, John Dorgan checks the day's patients.
Okay, see David.
We've got the light on.
How's his foot, Mum? Can we just have a look at it then? Yeah, have a look. That's okay. That little bit of blood stain is to be expected. Nothing to worry about with that. It looks fine. We'll come and see him tomorrow, and if he's okay, go home tomorrow. We'll leave you in peace then, okay? Hi, all well. Hi, Dad, nice to see you. Hello, it's all gone well, no problems. There's only a little ganglion, a simple little cyst, yeah.
Hi,
Is it sore? You awake yet?
Yes, I'm wide awake, aren't you?
Can you move your fingers for me? That's very good. No problems. It doesn't hurt at all. No. You want to go home? Yes, well, you can go home then, yes. Keep it dry is the main thing, so you're exempt from the washing up. All right? Good night then.
It's It's now 2.5 days since Antony Barrowcliff was injured when he fell off a fire engine. The intensive care team has decided to reduce his paralysing drugs. As he starts to come round, they'll be able to assess any damage to his brain.
Very good. What about his collar? Is it? Well, if neck X-ray's okay.
Antony, just open your eyes for us.
I'll give him the last few days.
Do you want to have a talk to his mum?
Yeah. Hiya. You can see that his movements are very, very good. We're very pleased with that. I know it looks distressing to see him reaching for the tube, but as far as we can see, he looks like he's certainly going to make a good recovery. Okay. Good. There's different sorts of movement along a scale, the worst of which is extending. So patients can extend their arms in response to stimulation, and that suggests severe damage. They can flex their arms but not bring them to the stimulus. And that's a level up, but not as good as somebody actually reaching for the stimulus that they feel is irritating them. So we're very pleased by the positive nature of his response.
Nikita's been receiving her injections from one of Alder Macmillan nurses.
I'll do the same. Get in the middle.
This means she can enjoy a few days at home before she returns to hospital.
You're going to sit on your mum's knee like you've done every day. That's great. OK, has Mum got the plaster ready? Yeah. OK, relax. Good girl. Relax. Well done. Relax. OK, good girl. Just a little bit more. OK. 1, 2, 3, and plaster on. Well done, Nikita. OK.
Only when Nikita returns to Alder next week will the doctors know if this stage of her treatment has been successful.
Go back inside and take your blood.
Back in intensive care, Antony is waking up more quickly than the team expected. The tubes that have been carrying oxygen into his lungs since he arrived in intensive care can be removed. He can now breathe for himself.
Just breathe in nice and deeply, Antony. Just some nice fresh air. Good lad. Well done, sweetie. All right, just lie down, Antony. Okay. All right, Mummy's here, sweetheart. Mummy's here.
Antony's parents will now have to wait and see if he suffered any long-term damage.
Plenty of fate left in him, yeah.